The following is an in-service training program presented by Nutrition Care Systems. Today's topic is on Hipaa. Today's learning objectives are: number 1, to understand the origin of Hipaa. Number 2, to explain the different areas of Hipaa. Number 3 is why Hipaa is important. And number 4, implications for healthcare professionals. So what really is the origin of Hipaa? Hipaa actually stands for Health Insurance Portability and Accountability Act and was actually passed by Congress back in 1996. Hipaa requires the protection and the confidential handling of protected health information. We'll talk a little bit further in the presentation as far as what that includes. And then Hipaa is able to mandate industry-wide standards for healthcare information on electronic billing and other processes. So what are the different areas of Hipaa? The Hipaa privacy rule has established standards for the protection of protected health information and gives patients important rights in regards to their own health information. It also permits the use and disclosure of health information needed for patient care and other important purposes. So some of the examples of protected health information could include a patient's past, present, or future physical or mental health condition, the past, present, or future payment for healthcare services, or the provision of health care to the patient. It also can include information such as Social Security number, address, birthday, etc. So the rule includes safeguards that cover entities and business associates must implement to protect the confidentiality, the integrity, and the availability of electronic protected health information so that all people are protected as far as their personal health information. Now, the reason Hipaa is so important is that it was really made for the consumer, not the healthcare system or other institutions. It protects the patient's privacy, and it only allows certain people to view important medical records and allows a patient to designate who can look at their record so that not everyone is able to access their medical record. Patient usually fills out a form with names of who can have access to their medical records. And again, this is a safeguard for the patient's privacy. There's another part to Hipaa also, in that the patient has a right to have a copy of their medical records, and sometimes there's a charge for that, but they have a right to a copy of anything in their medical record. So how is this related to healthcare professionals? So here's a list of some information that should be protected as far as patient information. Patient's name, address, telephone number, age, diagnosis, surgery, date of procedure and medications, medical history information, results of physical examinations, laboratory, and other diagnostic results, billing records, and claim forms. So really any information that could be used to identify the patient is protected under Hipaa. So that's why it's really important if you have a resident or a patient census sheet that you don't just throw it in the garbage, that you actually put it either in your shredder or have a designated area for that type of information. So all the above information is protected in any format, whether it's written, electronic, or verbal. There are certain organizations that do not have to follow the privacy and security rules, and that can include life insurance companies, most schools or school districts, most law enforcement agencies, and many state agencies like Child Protective Services would be an example. Also, healthcare professionals should always remember that it is best to discuss patient information with only those that are really involved in that patient's care, and do it in a controlled, private environment, not out at the nursing station with a bunch of people that really have nothing to do with the patient. Just be careful and cautious as far as where you're referring to information. And sometimes people, instead of referring to a patient's name, they'll actually refer to their room number. Instead of saying, "What about Mrs. Jones?" they may say, "What about room 203B?" We're going to take a short quiz and find out what you learned about HIPAA. First question, what year was HIPAA passed? A, 1986, B, 1996, C, 1998, or D, 2001? The answer to question number 1, what year was HIPAA passed? And the answer is B, 1996. Question number 2, who passed HIPAA? A, the Senate, B, Congress, C, President of the United States, or D, all of the above? The answer to question number 2, who passed HIPAA, would be B, Congress passed that law. Question number 3, protected health information includes all but the following: A, address, B, social security number, C, name, or D, all of the above? So question 3, protected health information includes all but the following. If you remember from the in-service, all of the above are protected health information: your address, social security number, and name, amongst other things, but those 3 definitely are protected. Question number 4 is a true or false question. It is okay to discuss patient health information in an open area where anyone can hear. And the answer is false. Remember, you're not to discuss patient information in an area where other people can hear you that have nothing to do with that patient. Question number 5 is another true or false question. HIPAA stands for Health Insurance Portability and Accountability Act. The answer to question number 5 is true. HIPAA does stand for Health Insurance Portability and Accountability Act. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service programs or our consulting services, please contact us at Nutrition Care Systems, 1275 Davis Road, Suite 121, Elgin, Illinois. Our number is 800-761-9200, or visit us on the web at nutritioncaresystems.com.